Good morning, everyone. Welcome to the August 12th Public Health Media Briefing. We have a couple public health staff who are going to give you updates on a few things, and then we will have time for questions. As always, please raise your hand or put your question in the chat box and I will call on you one question at a time. If you have additional questions, please get back in the queue. This is being recorded and I will post the recording to the COVID website this afternoon, as well as send the link for download to all of you this afternoon. With that, I'm going to hand it over to Dr. Kassirieh for an update.
Thank you and good morning everyone for joining us today. So I'll start with a brief update of the numbers, and these are numbers from yesterday. So we have 121,258 cases of COVID-19 reported to Sacramento County. We are averaging between 400 to 500 additional cases per day. We have 1,808 deaths reported so far, and we're averaging about 2 deaths reported per day. The case rate is right now at 27.5 per 100,000. With the hospitalizations from the last report we got, we have 348 cases of COVID-19 in the hospital. That includes 83 in the intensive care unit. This is the highest that we have seen of the COVID-19 case numbers in the hospital since January. And because of the impact on the hospitals as well as on the emergency room, especially with the staffing, we are making a request to the public that they reserve these resources, the emergency room and 911 and ambulance calls, only for emergencies that require that kind of care. We have heard reports of some people going to the emergency room to get just to get a COVID test. We have a lot of resources in the community for situations like that. So please reserve these resources, the ambulance, 911, and emergency room only for emergencies. So with that, I'd like to turn it over to Nick Maury to give an update on state health orders.
Hi, everyone. As you may have seen, yesterday, the California Department of Public Health issued a new health officer order affecting schools. Specifically, it affects all workers at transitional kindergarten through 12th grade in public and private schools, requiring the schools to document proof of vaccination for all workers, paid and unpaid, on those campuses. Any worker who is unable or unwilling to provide proof of vaccination will be required to undergo weekly testing for COVID-19. I'm going to turn it over to Carlos Casio. He's going to talk about a couple other health orders.
Good morning. On August 5th, California Department of Public Health issued a public health officer order. 2 of them actually, both directed at healthcare settings. So the first requires workers in healthcare settings in a variety of settings, including skilled nursing facilities, hospitals, intermediate care. There's a list of facilities that are included in the order, requiring workers in these settings to be fully vaccinated or receive their second dose by September 30th. Those who do not get vaccinated or are not able to provide proof of vaccination will need to begin testing at least weekly or twice a week, depending on the setting that they're in. And it'll be incumbent on the employer to document whether their workers are vaccinated, their vaccination status, or the results of their weekly or twice weekly surveillance testing. The second order is directed at hospitals, skilled nursing facilities, and intermediate care facilities to verify that visitors to these facilities are fully vaccinated or have a negative test for COVID-19 in the 72 hours prior to an indoor visit. And that's the health order.
Mike Nguyen.
Hi, everyone. I want to share with you all about our vaccine influencer trainings that we are hosting. We had one yesterday. So this vaccine influencer is an opportunity for community members within our county to come out to learn about vaccine information, to combat any misinformation, disinformation, and kind of disseminate and be trusted messenger, leveraging community members. So we had an event yesterday with the Latinx community. Following next week, we're going to have another one on the 18th from 2 to 4. It's going to be via Zoom. I will share the flyers with the Black and African American leaders and community members. And then we're going to have a general one in September 1st, and then one specifically with Russian-speaking community members. So I will share those details with our public information officers, and they will share with you all about the flyers and details. And that concludes my vaccine influencer update.
So I'll jump in with a testing update. So we've actually seen a significant increase in the number of residents getting tested in our county. If we just look at our community test sites, the number of tests administered last week, just over 7,800, was triple the volume we saw 4 weeks earlier when about 2,400 tests were administered. And that's great. We want people to get tested, and we also want to make sure they have as smooth an experience as possible. So with this increased demand, we want Sacramento County residents to know they have a number of options available to them. We currently have 13 community test sites in some of our highest need areas around the county, offering both rapid antigen and PCR tests. And participants can either walk up or pre-register. We also have PCR testing going on by appointment at Cal Expo with our curative partners. All testing is free, whether you have insurance or not. And additional information such as days and hours of operation for each site, as well as additional testing options such as retail pharmacies, can be found by scrolling down to the Get Tested Today section on the main Sacramento County COVID-19 page. We've actually worked with many of our community partners to expand hours of operation, as well as hired additional staff to accommodate the increase in demand. So we highly encourage residents to check our website first for the latest information. And lastly, we also encourage residents who do have insurance to check with their health plan for testing options that might be available with their care provider.
With that, we will end the update portion from public health staff and open it up to questions from the media. Alex Yoon Hendricks, go ahead.
Hey there, Alex from the Sacramento Bee. I wanted to touch on that testing element. So we've heard reports that at some of these county-run test sites, there is upwards of a 2-hour wait to get a test. I'm wondering, beyond increasing staff, is there going to be any sort of increasing supply or increasing the number of county-run test sites? Yeah, that's my question.
Yeah, so I mean, we're kind of always looking at options to expand community testing. I think what we saw over the last couple of weeks is us kind of responding to that increase in demand. And recognizing that, you know, it's a matter of expanding hours, adding staff capacity, really. And so we're pretty confident that moving forward, we'll be able to meet that demand. I think also it's part of why we want to get the message out to the public to check our website for the hours of operation, to understand that, for example, many of our sites close for lunch. You know, we based on just kind of that increase in numbers, you know, well, I think that's pretty much it. I mean, we want to make sure that folks know what to expect when they're going. Yes, these are walk-up sites, but we also encourage folks to pre-register. That'll hopefully expedite the process while they're there, the check-in process.
Michael, go ahead.
Hi, this is Mike Sackby. Do we have any recent numbers on infection and hospitalization rates among children during the spike that's been attributed to the Delta variant? And on that same note, as more schools and districts start to return, just give kind of a general overview of what we're expecting in terms of, are we expecting to see outbreaks, and what's the general protocol if a campus sees a cluster of cases?
So with the hospitalizations, what we report on our dashboard just gives the number, but in order to get the additional information about age and other demographic information, we do have to request the records. So there is usually a delay in getting those records. We are giving regular updates to the Board of Supervisors as we get that information. So we will ask our epidemiologists to update that information and provide it to you through our PIOs. Anecdotally, because we do talk on a weekly basis to the hospital administration and infectious disease doctors, we do know that they are seeing a bit of an increase in the number of children that are showing up, but we still have capacity in the pediatric intensive care units. One thing that all the hospitals have noted is that when you look at the average age of the people that are hospitalized, that has dropped. In previous surges, the average age has been in the 60s, but now it's dropped to the 50s. And that is an indication of some of the characteristics we've seen with this surge, especially with the Delta variant, that it is impacting younger people. And that's what is reflected in the hospitalizations as well.
We also received a question from Sammy with Cap Radio, which I'll read. County numbers indicate that only 1/3 of unhoused people are vaccinated against COVID-19. Why is that number so low, and what efforts are underway to raise it? Additionally, how rapidly has the Delta variant been spreading in homeless camps, and what can be done to prevent that spread?
Hi there, Liz Gomez here. Great question. So we have a specific effort for vaccinations for persons experiencing homelessness. That effort includes Ellicott, Sutter, UC Davis, and WellSpace, and has been going on for a couple months and will continue on moving forward. We've given 1,956 doses with that partnership as of August 3rd, and had over 175 vaccination events at shelters, camps, and community events. And the point in time count says, there's about 5,570 persons experiencing homelessness in Sacramento County. So we definitely have room to grow in terms of serving this population. And I think that we just need to continue to build trust, build those relationships, and have those conversations, because as we've seen, it's just taken time. Many of our events see 1 to 5 people, and we just need to continue to be out there. I'll defer to Dr. Kassirier around the Delta variant question.
So about the Delta variant, a couple of things to note. One is that we do have to send these specimens to the state. And so not every specimen is sent to the state for sequencing. Only about 10% of our cases are sent for sequencing. And we know that from previous results that have been returned, all of the specimens are the Delta variant. As far as specific to the homeless, we have not had a lot of cases that are identified as homeless or unhoused, but sometimes that information is missing. So we will continue to update. But right now we do not have any large area that is of concern as far as among the homeless.
Brandy, go ahead.
Thank you, Brandy with the Natomas Buzz. Typically, you guys are sharing breakthrough case data during these briefings. Is any of that available today?
Our epidemiologist is not on the call today, so we will check in with her for an update on that.
Okay. Daniel from KCRA, go ahead and ask your question.
Hi, my question is, I know you said that testing is free, but what about people that may need to get tested for their job or travel? Are there any, we know that some insurance companies say that surveillance testing isn't covered. Are there any county sites where people know that sort of thing is covered?
So at all of our community testing sites, you don't need to have a reason for coming. You can come for whatever reason makes sense for you. So all of our community testing sites, you're able to go for you know, whatever might have come up that has led you to consider getting a COVID test.
I want to point out also that especially if it's for travel, our advice is that people check with the destination to find out what the specific requirements are, because some destinations require testing only from certain sites. So you need to be sure that you're doing the correct test, and also that the site that you're going to, the results will be accepted for the air travel.
Okay, sorry, and just to follow up then, if you're at a community testing site, you can go for whatever reason, but that doesn't mean that you would get a bill later from your health insurance.
That's correct. You will not get a bill from your health insurance.
Okay, that's different than.
And if any community members do, I've worked with them individually to figure that out with the state, so just let the county know.
Okay, cool, and the list for that is on the website. It's not necessarily like people Googling it. They could go to urgent care, it might be something different.
I didn't quite understand that question.
Right, I know that if people go, if they Google, you know, COVID test in Sacramento, a lot of places will show up like urgent care facilities where they charge for tests and things like that. So if people want to be sure they're getting the free test, they need to check your the Sac County Health website, right?
That's correct. So what I'm speaking to is only about the Sacramento County operated sites.
Brandy, go ahead.
A follow-up question in regards to schools. Schools in Natomas have been open for a week. Is there a point where a number of cases at a school site would cause a school-wide quarantine or any action by the county?
I'll start off and then I'll let Nick talk more about our school team. We do have a school team that works very closely with the schools to get reports of cases and help with making decisions on quarantine. Right now, we do not have a specific number, but definitely if we are seeing an increase in cases or an outbreak that is growing, we would consider appropriate action, of course, taking into consideration that as much as possible, we are trying to minimize having to put children out of school. So that's why it's so important for us to be able to make determinations on who needs to be quarantined and who does not. We have been working with Elk Grove School District that's been open for quite a while now. And I'll let Nick talk more about how they're working with.
Yeah, no, I think that covers it pretty well. We, like Dr. Kasiri said, we have regular communications with schools, public, private, and charter, and they are required to report any cases and close contacts to us. So, you know, as long as they're doing that, we're generally pretty aware of what's happening in the schools, and we have very open lines of communication, so it's not uncommon when they start to see something happen on their campus for them to reach out and seek consultation from one of our public health nurses on how to move forward. That question has come up from some of the schools as well, because there were thresholds for either cohort closures or entire school closures last year. But as Dr. Kasiri mentioned, those are not currently in place. And so we are handling individual cases and outbreaks on a case-by-case basis.
Michael, go ahead.
Yeah, Mike, with another question. We're seeing some reports literally in the last hour or so about San Francisco's planning to implement a sort of a vaccine verification system for public settings like restaurants and bars. My understanding is that the city of Los Angeles might be considering something. So I was just curious, is there a mechanism in Sacramento County for that to be, because in those San Francisco and LA, I understand that would be like the city ordinance. Is there a mechanism that could potentially be used to do that at the county level in Sacramento? And if so, has there been any talk or consideration about something like that?
We are not considering it countywide at this time, but we have had several businesses reach out to us with an interest of being able to set up a system for vaccine verification and testing, especially for indoor events.
Alex, go ahead.
I wanted to ask, maybe following up on that vaccine influencer component, but right now it seems like it's like 18 to 30-year-olds that's really lagging behind in terms of vaccinations. I'd love to get some clarity as to why we're seeing that trend and what the county is doing to address that, especially with the Delta variant. Thanks.
Definitely, I could take that one. For 18, 30 years old, we are working, we are aware of that. So we are working again with our trusted messenger. This includes like the schools, the community-based organization, specifically working around younger adults and youth. To answer your first part of the question, there are a lot of contributing factors, right? And it looks different for each community with their intersectional identities of race, class, and other demographics. So with that, this is why we're being really intentional about leveraging and working with the specific groups and that to really increase in combat. And I think this is where we're leveraging that vaccine influencer to really mobilize. So within the vaccine influencer, we are working with higher education systems like our community colleges and our healthcare schools here to see how we can mobilize that specific age group. So then we could equip community members with the proper and accurate information so they could go and disseminate, talk to their peer, the importance of vaccination and combat any misinformation, disinformation. In addition to that, we are also doing some media campaign and educational, working with our partners to really disseminate through the channels where youth and 18, 30-year-old are tapping and tuning into. So that is another aspect. So we're continuing those efforts.
Brandy, do you have another question or is your hand still raised from your previous one?
Sorry.
No worries. With that, it looks like we don't have any additional questions. So this concludes the August 12th Public Health Media Briefing. I will send the link for download out to everyone this afternoon. Thank you.